Good evening. I'm Lou Goldstein, and welcome to another edition of Focus On. My guest tonight is Jeannie Miranda, who is the owner of a great new physical therapy company called Turning Point Therapy. And we're going to be talking a lot about not just physical therapy, but we'll be talking about specific areas of physical therapy that may help you. I know many of you have aches and pains and migraines, and you may want to listen to this because this may help you as far as relieving your pain and thinking about alternative sources that you can go to. And Jeannie's going to talk a lot about not just her company, but she's going to talk about the basically the therapy approach that is new and that could basically help you. And so we're going to be talking a lot about myofascial release. But first of all, Jeannie, thanks for coming.
Thank you.
Thanks
for having me.
It's great to have you here, and hopefully, we'll get a lot of information so that people know what to do, and they can always, contact you, I'm sure, at any time, in your office in New Hope, Pennsylvania. So, but first of all, I'd like to give everyone a little bit of background about Jeannie. She's a graduate from Quinnipiac University, and she obtained her BS degree in physical therapy. And she has over 35 years of physical therapy experience, having previously worked in a variety of settings, including pediatric hospitals, the NICU unit, early intervention, school, and outpatient settings. In April of 2021, a little bit over a year ago, she decided to open Turning Point Therapy, which I mentioned earlier, as a model of holistic healthcare dedicated to healing mind, body, and spirit. And her own personal experience with migraines over her lifetime, and having gone through myofascial release, has helped her, because sometimes she'd get 15 migraines a month, and by going through this process it helped, because pharmaceutical medication was taking its toll, and sometimes there has to be another option. And unfortunately, this led her to myofascial release, and to this day, as we talked before, you remain migraine free, which is wonderful. She's worked with many people. She's a yoga teacher too, and she believes in the body's natural ability to heal and is passionate about the effect of MFR. Her diverse background experience and unique training allow her to treat clients of all ages with skill, empathy, and intuition. So if you're looking for improved alignment, increased flexibility, and or decreased pain, it would be worth your time to stay tuned for the next 30 minutes as we talk a lot about physical therapy and its benefits. So Jeannie, first of all, what is myofascial release for everybody who's listening?
So myofascial release, it's a manual therapy. It deals specifically, it focuses specifically on the fascial system of the body. The fascial system is our connective tissue system, and we previously thought it was just an insulator in our body. And we've subsequently found out that it's a whole lot more. It's part of our autonomic nervous system, which is our fight or flight and our rest and digest systems. And with that, there's so many more implications. It turns out that the fascial system is a major communicator in our body. Not only does it support us and keeps us all together, but it allows us to expand. And then it also it runs from head to toe throughout the whole entire body. It's the only system of the body that touches every single cell of the body.
It's amazing. So how does the fascia become tight? So
the fascia can tighten. There's three components of fascia, basically, or three types of fascia. There's a superficial layer, there's a deeper layer, and the deepest layer surrounds the brain and the spinal cord. And then there's, in between all of the fascia, is something, there's a gelatinous component that we refer to as the ground substance. Right. And with trauma, emotional trauma, physical trauma, surgery, inflammation, or postural habits or repetitive use, that can harden that gelatinous substance. And when that gelatinous substance gets hard, it can cause restrictions through the body. So with myofascial release, we specifically address those restrictions so that that can alleviate any sources of pain or discomfort or malalignment within the body.
Okay. Now, earlier in the introduction, I talked a little bit about you. We talked about the migraines that you've had for most of your life. Can you talk a little bit about that and basically what brought you to myofascial release, and how severe they were?
So from my earliest ages, I remember being on the playground in 3rd grade and having headaches.
Yeah.
And I've always had headaches and migraines. I had gone to a headache center and I was experiencing migraines, up to 15 migraines a month. I was on daily medication, abortive medication, and rescue medication. Times I needed to go into the hospital actually for infusions because the migraines, the cycle was that bad. I noticed that I didn't like the feel of the medications that I was on.
Side effects, yeah.
Yeah, I didn't like them, and nothing was. I was only becoming okay during the migraines. I was only becoming barely functional, you know. So there were many times I would just be down and out, like completely completely in a closed room, dark, quiet, nothing, and I wasn't able to function.
Right.
I had learned about the myofascial release, kind of came back to it. I learned about it in PT school, but how we studied myofascia, we study it on cadavers, and oftentimes because the fascial system is so fluid rich, when we're studying cadavers, we're studying a completely different system. So it's kind of like comparing a telephone pole to a live tree. There's a big difference between that, you know. So, as my work exposed me more to myofascial release, I had gone for treatment, and when I had gone for treatment with myofascial release, again, just addressing the restrictions within my body, that allowed me to be completely migraine-free, completely medicine-free by just addressing those restrictions. The restrictions were actually from old injuries, from old falls when I was a little girl and broke my coccyx, you know. So, and that was enough of a pull on my dural system, that deep layer of the fascia, to perpetuate those migraines.
So it's not necessarily the point of pain that you're feeling, it can be from other points within your body.
Exactly, because the fascial system touches every single cell of our body, it can be, you might experience shoulder pain, but it could be coming from your hip, or it could be coming from your rib, or your leg, or something like that. Knee pain could be coming from your diaphragm, or from a hip that's not in alignment. So it can come from different areas because the fascial system is connected. And that's one of the things that makes it so unique with the one-on-one approach that in treating with myofascial release, because it's very individual. Your body, only you have been in your body for as many years as you have been. Only you have experienced the fall when you were 3, or the car accident when you were 15, or whatever. So because the fascial system is its first job basically is to support us. It supports our body, and that's why it becomes very unique to you. Your system supports you in the way that it needed to at that time, you know. So
right. So there basically also there's like 3 areas, you know. Basically, you know, the Triad of Healing. Yeah. Right. Basically, with structural work and unwinding and rebounding. So could you break that up for us and talk a little bit about what's structural work, what's unwinding, what's rebounding?
So that's one of the things that I love most about the approach that we use, and that's what differentiates us from traditional physical therapy, because it is truly healing mind, body, and spirit. You can, as a traditional physical therapist, which I function under, but as a traditional physical therapist, I'm treating a specific point of your body that's dictated by either a physician's prescription or by insurance.
Right. So if I have a knot in my back.
If you have a shoulder problem, I can't go work on your knee.
Right.
Until I get that changed. You know. So with the way that we work is we look at the whole entire body, and so we're assessing you head to toe, seeing where the lines of pull might come in. You might have come in with a shoulder problem, but your shoulder might be completely pulled down from the one side. So then I know I need to look further. I need to look for those lines of pull. And as we do that, I'm looking initially for the areas of restriction within your body, areas of restricted fascia. So then I know where to go, where to start with treatment. The myofascial release consists of a triad of healing. So it is, like you said, the structural work, unwinding, and rebounding. The structural work is our actual hands-on work, and that's where my hands are sinking into your fascial system. It's a direct skin-to-skin contact, so I sink into your system, and then slowly, because it is our protective system, I can't force it. So it's always gentle, sustained pressure at the area of resistance. So then that way, with that gentle, sustained pressure, it causes an actual phase change with the hardened gel-like substance. So you can create lasting change within that system. Right. The unwinding piece is the part of our body. Our bodies truly want to heal, and this is the part that's kind of been ignored by a lot of the medical systems, because our bodies, because it doesn't always fit into specific diagnosis, you know, or specific category. When you allow your body to let go of any kind of mental restrictions, so, you know, kind of thoughts that are holding you in a state of like more of your logical mindset as opposed to your intuitive mindset. When you allow your body to take over and just trust that, your body will seek positions of past trauma to let go of the energy that's stored at the cellular level. Okay. So what happens is when we experience trauma, there's often, in order to survive trauma, whether it's physical, emotional, whatever type of trauma, our body absorbs the energy of that trauma. Okay. And at that point of trauma, we almost go into a state of disconnect. Where in order to survive that trauma, that's our fight. It's part of our fight or flight system. Right. We can fight, flee, or freeze. So and in all of those, there's energy involved in that, and sometimes that energy, when it's stored within our body, it creates dis-ease, and that dis-ease will often eventually become labels.
Okay, dis-ease. Huh?
Yeah, okay. Dis-ease as opposed to disease. Disease,
right. And I guess patients feel various physical sensations over a period of time too, right?
They can. So what happens is that because it's gentle, sustained pressure, there really is we don't force that system. The system's designed to be protective. So if we force the system, right, you're going to engage the system, and then you can't release it. So the system is designed to. It's all gentle, sustained pressure, skin to skin contact, and what we do is we hold. The difference with this type of fascial release, as opposed to the type of fascial release you get at the gym and rolling and stuff like that, the sustained pressure, 3 to 5 minutes of sustained pressure, actually causes a phase state change within that gelatinous substance that hardens with trauma. So we actually have an actual cellular change that occurs by the pressure of our hands. The other beautiful thing about it is, with sustained pressure, we know that gentle sustained pressure will have our body start to release interleukins, its own anti-inflammatories, at 3 minutes. Right. At 5 minutes, that we know that those interleukins double. You know, so a lot of times we hold, not to sit there and wait for the 5 minutes, but we hold until that barrier is released. A small little restriction the size of a postage stamp, 1 square inch, can cause up to 2,000 pounds of pressure, of tensile strength. It's that strong. So we can't force that system whatsoever. So if you think like, oh, I have just this little scar, that little scar can cause restrictions, and not only restrictions in that area, it can cause restrictions throughout your whole entire body.
Wow, wow. So people who go through this, do they notice a change over a specific time period? You know, it's like a month, or, you know?
Most people that go through it will notice immediate changes. Like most people that experience it, first their typical response is like, wow, I didn't really feel anything, because a lot of people are used to more rigorous deep tissue massage, and like I said, this system can't be forced. So so when we use the gentle sustained pressure, most people feel very like lively and very invigorated afterwards, because it truly is a beautiful healing modality. And as I was saying, like it can, because it's a triad of healing, you can start to address those things that we've stored inside all of our lives, you know. Right. So when those things can be released, we no longer hold that. We no longer have to hold that within our bodies and within ourselves.
Okay. So let's talk a little bit more. You talked a little about rebounding too. Let's talk a little bit more about how myofascial release is performed. Mm-hmm. You know, so everybody can get an right. idea if they walked into your, you know, into your office and said, okay, I'm here, you know, and I know it's going to be, you know, full body, it's going to be hands-on, but what can I expect? What are you going to do?
So when they come into my office, I treat as a physical therapist. So the first thing that I do is I'm going to evaluate their body, and I'm going to look at their body, look for asymmetries, look for lines of pull, and then I'm going to feel for those restrictions within the fascial system. I use the bony alignment as a way to try to see, like, is there an asymmetry or not? Is there a tendency? Their history gives me clues as far as where to look. As they get on the table, we usually have them wear like very comfortable, loose-fitting clothing, because it is a skin-to-skin contact. We don't have any oils on the skin or anything else like that, because we don't really want to slide on the skin. We want to sink into the skin and engage into that fascial system. Right. So there's no oils or lotions or anything else like that, because we actually sink into your fascial system, engage that system, and then look for the restrictions. Hold at those restrictions, and then continue to look for those restrictions. Usually, what's a beautiful thing about the fascial system is, as we're working on someone, there's something called the fascial voice. Sometimes, as we're working, I could be working on someone's diaphragm, and then all of a sudden I'll notice their neck become bright red, or I could be working on their chest and notice their face get bright red, and that's usually what we call the fascial voice. That the fascia will tell us where to go to next, or where there's more areas of restriction. Right. So my hands they're gentle. They're not designed to, we're not digging.
Hurt, right? No.
We're not digging in. Some people there is something that sometimes, because we hold emotion at the cellular level, when we release that emotion, mm-hmm. sometimes it feels the same as if we had experienced it, but that pain can never be injured. Like, you can never be injured by that pain again, because what your body is doing, your body is actually completing that process, as opposed to stepping out at the time of trauma. You're allowing your body to complete that process, and once you go through that process, it's done, and you don't need to knock on the door every single time. Okay. So a lot of times when we hold it in and we're avoiding it, it's kind of like we're knocking on the door, but we're not going through, you know. So, and this allows us to really go through in a non-injurious way, and then it's done, it's released, and then it usually is never a problem. So sometimes the fear can be a little bit more painful than anything else. So.
Does this fear sometimes make people tighten up while they're on the table and prevent the benefits of myofascial release from coming sooner?
It can. It can. Sometimes there are clients that are so fearful or so worried, or sometimes there's things that they don't want to really look at. They're not ready to really let go and look at. So they might hold their body in tension. There are ways around it. Rebounding is a beautiful way. That's the other component of the triad. And rebounding is using the fluid system of the body to kind of help release those restrictions and rehydrate the system and release the holding patterns, because a lot of times we walk around, especially as adults, we walk around in our holding patterns. Sometimes, you can tell the stressful day when my shoulders are up to my ears and my shoulders become my earrings, because that's my holding pattern. Other people have different holding patterns, you know. So that gives us so we can bypass that with because it's gentle. it's a lot easier to bypass because as opposed to being forced, you know, and forcing the system. But with that rebounding, using that fluid system, it kind of creates like a wave pool. Like have you ever been in a wave pool? And,
yeah, I've been in a wave pool.
And you feel like you still have that motion going through you, and that's basic.
Back and forth motion,
And it doesn't have to be back and forth. It can be side to side. It can be any direction, but because we have a lot of fluid, so it can go in any direction. And the other thing that does is it can help you bypass like your logical mind, the mind that wants to keep us in that protective state, you know. So a lot of times when you're it's really hard to not relax in a wave pool, you know. So and literally, like, as we do the rebounding, and rebounding can look as rigorous as a wave pool or can look very gentle too, and that helps to kind of bypass that part of the brain that wants to keep us in that protective state.
Well, that's what I was going to ask you. Is it a matter of fooling the brain too?
In some ways, yeah. In some ways, you don't. In some ways, it doesn't. You don't have to fool the brain in order to do that. For someone that's extremely fearful and extremely resistant or tight, that might be a way to bypass the brain. I believe that, and this is why I opened my own practice, because I truly believed you can't ignore the brain and just treat the body. You can't ignore the body, like you can't ignore the body and just treat the brain. And we're all a part of like one human being, you know, so with mind, body, spirit. So you have to treat that and treat all of that. The spirit part is, as I delved into the myofascial world, I realized that we're more than just our forms. We're energy systems. We have energy within our body, but we have energy systems beyond our body that we can't see. And in dealing with those energy systems also need to be dealt with too, because we can't separate out one system versus another. You know, we're all one big solid piece, you know. So that's an important thing. When you can just allow your body that freedom, you don't have to have someone trick the brain. If you can get into a state where you just like are in a very trusting state, kind of like the state where you know to trust your intuition. That state, like sometimes, you know, if you're facing a decision, so you go through, you might have your list of what you can do and you can't do, but then all of a sudden you just go with your gut, and it's like when you can just get into that intuitive side of you and allow your body to take over, your body will free itself of what it's ready to free itself of. Okay.
Now a lot of people who are listening to this may want to get in touch with you. Do you have a website or some way they can contact you?
Yes. The best way is right now by phone. My website is www.myofascialpt.com, and they can go on there and get more information on there.
Okay.
You know,
Okay. So you mentioned the fact that, you know, starting your own company. I'm sure it's a big difference starting your own company than working for somebody else. What's the biggest difference that you've seen so far?
My boss is really nice. But no, the big difference I like the autonomy of having my own place, you know. So, and I get to decide. I get to decide that I can bring in all of these other components. I don't have to just center on the body, or I don't have to just do completely myofascial release. I can incorporate energy work in with the myofascial release and help heal completely, as opposed to that. Because the fascia gets tightened when restrictions occur from trauma, and those traumas are sometimes stored. Sometimes if you're still experiencing that trauma on a cellular level, then you're only going to get better only a certain degree if someone's only addressing the body. You know, that's why a lot of the clients that come in I've tried everything and I don't know what to do, or I've gone to traditional therapy and that was okay, but I'm still not the way I used to be. And this allows for that complete healing.
That's great. Well, we're going to have a lot more to talk about in our next session, because we're going to go to part 2 of this, and that'll be next week. So until then, I'm Lou Goldstein, thanking you for watching Focus On. tonight. My guest has been Jeannie Miranda, who is the owner of Turning Point Therapy in New Hope, Pennsylvania. And you'll hear more of Jeannie's comments and how this physical therapy and myofascial release therapy can help you with some of your body's aches and pains in the future, just by checking in on it. So until next week, I'm Lou Goldstein. Thanking you for watching. Stay healthy, stay active, stay focused, and I'll see you again on another edition of Focus On. Have a good night.